Dr. Rao, you've invented a voice box for those who have lost their voice box because of cancer or something. Yes. Could you just show it to us and tell us how it works?
So this is what we have innovated. It's a simple voice prosthesis that we have done. We've called it as Om voice prosthesis. It's a $1 speaking device which fits into the throat of a throat cancer patient. Now technically, throat cancer patients, once they lose their voice box, especially in stage 4 throat cancers, can't speak again. So what this device simply does is cheats the brain to tell it all is well. It simply cheats the brain and makes your brain understand that all is well, and suddenly you realize that the food pipe vibrates like the voice box and makes a patient speak again. To start with, for a layman, he needs to understand that he does not speak through his throat, he speaks through his brain. It is your brain that speaks and it's not your throat. So for example, when I ask you what's your name, your brain is going to listen to it through your eardrums, which are going to hear it through your ear now, and then go to the brain, which processes what is your name in that format, and then gives instructions to the brain to program it again. That's how mimicry works. That's how you're able to actually imitate people, because it's your brain that actually, if you're able to imitate Amitabh Bachchan today, it's because your brain knows the frequencies in which those sounds are produced. So it's the brain that speaks and not the throat. This is a simple voice prosthesis that sends air from the lung into the food pipe so that the food pipe can vibrate like the voice box.
And how much does this cost?
We've priced it at 50 rupees. Okay. It's less than $1, purely because speech is a right, not a privilege.
Right. And before this invention, how much would someone have to pay to get a voice?
Somewhere between, if you look at the government scheme for below poverty line, these Western devices are sold at 30,000 rupees. To if you go to any other private hospital, it may be about 45,000 to above that. To sometimes there are some newer versions which cost 1.5 lakhs. This is my little wooden device and my prosthesis sits inside it. So this is my voice prosthesis for throat cancer patients, which actually is a simple one-way wall device. And it usually, this is how we fit it in. So this is the part, this is the wooden device with a little locking mechanism, and then you fit this part in, and then you take it typically here, you fit it into the throat at this point. So you take it in here and then slowly gently push it in. Bingo.
And it deposits the voice box inside?
Into the throat, yeah. And this takes about 30 seconds as compared to 15-20 minutes minor procedure room going inside out and all that. So that way, currently, I used to earlier had to take them at least to a minor procedure room. Now I fit it in the OPD itself. So I have about 5 patients right now receiving this after I've cleared all the permissions, and hopefully another few more, and then I'll be having to give this across to the country.